Boy, whoa!
Nemo! Nemo, don't move! Don't move! You'll never get out of there yourself.
Some of us have hidden traumas. You might have noticed in yourself reactions that seem irrational from time to time. But irrational doesn't mean that there's no reason for why you do those things. Trauma work allows us to honor that our brains, our bodies, and our nervous systems were doing the very best they could at the time, but now we're allowed to start letting go of unhelpful patterns and unlearn what no longer supports us.
He says it's time to let go! Everything's gonna be all right!
How do you know? How do you know something bad isn't gonna happen?
I don't!
So let's say you've never seen Finding Nemo. And first of all, if you haven't, seriously, but okay, let's say you haven't, and you walk into the room where your little nephew's there watching it, and you sit down, and you start watching this fish named Marlin for a bit.
All right, we're excited. First day of school, here we go. We're ready to learn, to get some knowledge. Now, what's the one thing we have to remember about the ocean?
It's not safe.
That's my boy. So, first, we check to see that the coast is clear. We go out and back in. And then we go out and back in. And then one more time, out and back in. And sometimes, if you want to do it 4 times.
Dad.
All right, come on, boy.
And after a couple minutes of watching, you might say aloud, wow, that fish has some interesting personality traits. But your nephew would say, no, you missed it. It makes sense. And they rewind to the beginning of the film and show you this.
Coral, get inside the house, Coral. No, Coral, don't. They'll be fine. Just get inside, you, right now. Coral?
We've all had things that have happened to us early on that affected us deeply. And these things have become instrumental in shaping who we are today, how we think about others, ourselves, the world around us, how we relate to others, how we react to people, places, and situations.
There. It's okay, Daddy's here. Daddy's got you. I promise I will never let anything happen to you. Nemo.
Now, why this is important to remember is because a lot of us may be looking at things that we currently struggle with as if we've sat down halfway through our movie and we're watching ourselves do things and we're confused about why we're acting this way. We don't consider that what we're experiencing or how we are reacting could be a result of what happened toward the beginning of our story. Francine Shapiro, the founder of EMDR therapy, writes, "Every experience we've had in our lives has become a building block in our inner world, governing our reactions to everything and every person we encounter." Now, some of us have pretty recognizable traumas, and we have no trouble drawing a line between how we react today and something that happened to us earlier in our life. But some of us have hidden traumas, events that have happened so long ago, or sometimes happened so gradually over time, or so subtly, that we don't recognize them as trauma.
Babies this young are extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. In the still face experiment, what the mother did was she sits down and she's playing with her baby, who's about a year of age.
I'm like a girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this, and then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, "Come on, why aren't we doing this?" Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it. They actually may lose control of their posture because of the stress that they're experiencing.
Okay. I'm here. And what are you doing? Oh, yes. Oh, what a big...
Many of us have grown up in the equivalent of a still-face environment, where things we needed for our development were not given to us, so we had to compensate. These hidden traumas are affecting how we see ourselves, how we form relationships with others, and often explain many behavior patterns that form our personality. These unresolved traumas can often go undetected and unaddressed because they masquerade as parts of our personality. We think, it's just me, it's just the way I am, rather than these are the results of specific earlier experiences with trauma. Broadly defined, trauma occurs when the brain, body, and nervous system have learned unhelpful lessons and responses that we are applying now in the present and that are causing problems for us. These responses often came about as a reaction to and a way to try and survive what we were experiencing at the time, but these unhelpful lessons learned continue to stay with us and don't serve us now. You might have noticed in yourself reactions that seem irrational from time to time, but irrational doesn't mean that there's no reason for why you do those things.
Where'd you go?
Dad, can I go play too? Can I?
I would feel better if you go play over on the sponge beds. That's where I would play.
An important part in resolving trauma is to allow the brain, the body, and the nervous system opportunities to learn new lessons and new ways of responding. Thankfully, some of our traumas process out of our system naturally. Life just sometimes provides us with experiences that help the brain learn these new lessons. Marlon had several experiences over the course of his journey that helped him process early traumatic experiences.
Oh my goodness!
Whoa, kill the motor, dude. Let us see what Squirt does flying solo.
Whoa! That was so cool! Hey, Dad, did you see that? Did you see me? Did you see what I did?
You so totally rock, Squirt! So give me some fin. Noggin. Dude.
It's important to remember that many of us learned early on certain ways of reacting as coping or survival mechanisms. These promised safety when we felt we needed them early on. But sometimes the brain continues to hold on to those responses long after they're needed.
There. It's all right. It'll be okay.
No, it won't.
Sure it will. You'll see.
No, I promised him I'd never let anything happen to him.
Huh. That's a funny thing to promise.
What?
Well, you can't never let anything happen to him. Then nothing would ever happen to him. Not much fun for little Harpo.
This holding on hurts us. It hinders our growth. Trauma work allows us to honor that our brains, our bodies, and our nervous systems were doing the very best they could at the time, but now we're allowed to start letting go of unhelpful patterns and unlearn what no longer supports us.
He says it's time to let go! Everything's gonna be all right!
How do you know? How do you know something bad isn't gonna happen?
I don't!
When you notice a way you're reacting that doesn't serve you, maybe a sensation in your body or an emotional reaction or an unhelpful thought pattern, you might ask yourself, where and when did my brain first learn to react this way? That question can give us insight into what early experiences need to be processed so we can let go of our past trauma
Bye, son.
and begin to experience a much better future. Okay, 2 last things. First of all, if content in the Play Therapy series is helpful to you, don't forget to like, subscribe, share it with a friend. And second, if you think you or someone you care about may be experiencing some unresolved trauma, I've included a couple links down in the notes section of this video that introduce a therapy approach called EMDR that many find extremely helpful in addressing trauma. See you later, dudes.
Like he's trying to speak to me, I know it! You know, you're really cute, but I don't know what you're saying!